Hello, welcome to my channel. My name is Nurse Pauline. Today we'll be talking about environmental safety, hazards, injuries, accidents. This will be part 1. I will be doing today questions and answers from RN NCLEX review. Please hit the thumbs up button, please subscribe, and please share this video with your classmates. The first question is, how do we prevent hazards in the hospital? How do we keep our patients safe while they're in the hospital? The correct answer is we will place the call lights close to the patients. We will make sure the patients are wearing their ID bracelets. We are making sure that our patients are wearing their allergy bracelets. We are going to make frequent rounds on our patients to make sure they're safe. Confused patients, will try to keep them close to the nursing stations. For patients, we're going to make sure there are grab rails in the bathroom when they go toileting. Make sure they are using their grab bars. We're going to make sure the patients are wearing non-skid slippers while they're in the hospitals. We're going to make sure the patients who are at risk for falls, most of the time the elderly, they are confused during the nights. Make sure the bed alarms are on. If you transfer them out of bed to chair, make sure the chair alarms are on. As soon as they try to stand up out of the chair, the alarm will go out. So these are some of the ways we are trying to make the patients safe while they are in the hospital. My next question, how do you handle body fluids in the hospital? The correct answer is consider everything as being contaminated. Wear clean gloves on all patients. Change gloves in between patients. Do not use one glove on 2 patients. Consider everything contaminated. When you leave the rooms, dispose of your gloves. Wash your hands. My next question, how long should we wash our hands? The correct answer is 20 seconds. You can use your sanitizer, and with C. diff patients, when you have an exam, C. diff patients, when you remove the gloves, you are washing your hands with running water. Even if you use a sanitizer, you will use running water is the correct answer. What are considerations for the elderly concerning safety? The correct answer or considerations for the elderlies are: the elderlies are at risk for falls, risk for burns, risk for motor vehicle accidents is the correct answer. Next question, what are the risks for infants? The correct answer, for infant, the risks are choking, toys on popcorns, on candies. Be careful with pacifiers. Lead poisoning. Use child-proof containers is the correct answer for risk for infants. My next question: what are our safety concerns for children under 3 years old? And the correct answer: they should be using their car seat facing rear. When bathing infants, check the temperature of the water. Check the temperature of your children's water bottles. Cover electric parts on top of the stove. Make sure on top of the stove, if it's hot or warm, make sure they are covered. Place things on the back of your burners are the correct answers. Next question: how do we prevent drowning in infants? The correct answer: we prevent drowning in infants by have them use helmets. Have them use their life jackets is the correct answer. Next question: what are infant safety risks? Is this question, and the correct answer: place infants in the prone position to prevent choking and aspiration when they are in bed. Prevent crib death. For infants, they are at risk for burns. Prevent playpen accidents. Prevent poisoning. Next question: how do we prevent carbon monoxide poisoning? The correct answer is have carbon monoxide detectors in the home. Also have smoke detectors in the home to detect fires is your correct answer. Next question: what are the signs and symptoms of carbon monoxide poisoning? The correct answer: carbon monoxide is a clear, odorless gas. Signs and symptoms of headaches, weakness, need detectors in the homes. My next question: what is the main cause of food poisoning? The correct answer: the main cause of food poisoning is E. coli bacteria, Listeria. Next question: there is a motor vehicle accident and a patient or the driver is bleeding. What would you do? The correct answer: in a motor vehicle accident, never ever ever, if possible, move your patients, because these patients, or if you have to move them very gently, because they are at risk for bleeding. They are at risk for internal bleeding caused by internal injuries. If patients are bleeding, apply pressure, please. Next question: what do we do in the case of fractures? How do we take care of fractures? The correct answers: for fractures, we assess swellings, deformities, check pulses, make sure they are present. Immobilize fractures with a splint is the correct answer. Next question: what is MSDS? The correct answer: This abbreviation is Material Safety Data Chemical Spills. These are data sheets for precautions for handling spills in the workplace is the correct answer for MSDS. They are material data chemical spills, data sheets for precautions of handling spills in the workplace. What do you do if the families or patients or visitors experience an accident in the workplace, in the hospital? What do you do? The correct answer is you first report it to your manager. You complete an incidents report. You write a nurse's notes. The next question is seizure precautions. What do you do if your patient is at risk for seizure? The correct answer, you will pad your side rails. During a seizure, do not put anything in your patient's mouth. Do not place a thermometer, nothing in your patient's mouth. Do not put a tongue depressor in your patient's mouth. Keep patient safe. If patient is lying on the ground, remove all the furnitures. Patient is at risk for injury. We do not want patient to hit his head against the furniture. Keep patient safe. Note the time the seizure started and the time the seizure ended is the correct answer. Next question is patients with sprains. What will be your action? And the correct answer is RICE. RICE acronym. R is for rest, I is for ice, C is for compression, and E is for elevation. These are your interventions for patients with sprains is the correct answer. What will be your intervention for patients with splints? The correct answer, assess that the splint is not too tight. We do not want to compromise the patient's circulation. Assess circulation. Assess presence of pulses. If pulses are absent, please notify the doctor immediately. What will be your assessments and interventions for frostbite? The correct answer, frostbite will take a look at the patient's earlobes and fingers. For frostbite, we'll use warm water. If patient is in pain, we'll administer pain medications. What will be our interventions for patients with burns? The correct answer is elevate extremities, provide IV fluids to keep the patient hydrated. Patient should be nothing by mouth. Make sure patients with burns have their tetanus shots. Please hit the like button please hit your thumbs up button. Please subscribe and please share this video with your classmates. This was part 1 of environmental safety hazards, injuries and accidents. Please stay tuned to part 2. Thanks for watching. Have a blessed day.